Many students come from families without the funds, and they are first-generation college students. I know firsthand what it means to be a first-generation college student. I had to get loans for my medical school education, and I spent years after completing my medical degree paying those loans.
I was a first-generation student. My father had a second-grade education. My mother did graduate high school. She wanted to go further. She was denied that opportunity. When I went to medical school, I didn't know any of the things that I needed to know. And I was alone. I had to fight. I had to struggle.
I didn't know how I was going to fund my own education. At the end of the day, I was going to continue working to accomplish my dream no matter how much it was going to cost me.
56% of our students come from disadvantaged backgrounds. 40% of our students are first in their families to go to college, much less medical school. It is important for us to nurture those students and to give them the resources that they need to become excellent doctors. They have the passion, but they don't have the money. They don't have the resources. And that's what the Mission Scholarship does, is it brings that necessary piece that they need to fulfill their goals of becoming a doctor. And in turn, it fulfills our goal of completing the mission of the UCR School of Medicine, which is to improve the health of the people here in inland Southern California.
I remember when I got my acceptance to UCR, I was so happy, I was elated, but then I started reflecting on the cost of actually obtaining that education, and there were some doubts in my mind. And it wasn't until I received the Mission Scholarship that really allowed me to take full advantage of that acceptance.
When I found out that I was a recipient of a scholarship, I was actually in Mexico. It was a tough time, and I was kind of on a little bit of a roller coaster that month. I got my white coat fitting, and a couple days later, a week later, my grandma passed away. And I think the email letting me know that I had received this scholarship kind of was like a little light. It lifted a burden off of me that in the moment I needed. I needed to know something was going right. Just knowing that I had other people out there supporting me in my goals without even knowing me, I'm very thankful to have seen that email in that moment.
The scholarship was so much more than just saying, hey, we want you here. It was them saying, hey, we see that you're gonna fulfill our mission and you're the kind of student that we want. UC Riverside was one of the first schools that I interviewed at that an Indigenous faculty member interviewed me and was able to connect with me over my heritage and being Native American. And that was something that really stood out to me, since a lot of medical schools, first off, don't have a lot of Indigenous classmates. They don't have a lot of Indigenous faculty members. And to come to a place that was close to home and a place that would allow me to serve my communities, but also to see that there were people who are Native American and serving in leadership roles at UC Riverside was something that was one of the biggest reasons for why I chose UC Riverside.
One of my big initiatives when I was here as a medical student was participating in Riverside Free Clinic, which is a free clinic orchestrated by the UCR School of Medicine staff. And that's when I really started to see the deep need of this community. These individuals didn't necessarily understand their diagnoses. They didn't understand what it meant to have diabetes. They didn't understand what it meant to have hypertension. And so I think not only providing them the services, but providing them the education was really a benefit for them. And I think that's something that UCR School of Medicine is trying to do, is to promote health literacy in this community and provide healthcare access.
I've definitely noticed that there's not a lot of Indigenous people who are taking up space within the medical field, and with less than 1% of doctors being Native American, it's definitely something that needs to be pushed for and needs to be advocated for. So it's given me a passion to work with Native American communities after medical school and to work in tribal hospitals and to be a physician that genuinely wants to serve Indigenous communities. In my future, I would really like to mentor, and to be able to push for more Indigenous representation within medicine.
During my first year, I volunteered with Coachella Valley Free Clinic. In the Coachella Valley, hospitals are a good hour and a half away. A lot of the community that we work with are farm workers, undocumented, low income, don't have insurance. During my first year here at UCR, I already had the opportunity to go out to the Eastern Coachella Valley to start working and start building relationships with the community that I eventually want to be practicing and helping with. Being here at UCR has helped me be able to start helping the community out there and start making a difference out there. Even as a student, I was very thankful to have had that opportunity so early on in my education.
The Mission Scholars Program is a wonderful way to fulfill our mission, and thus the name, the Mission Scholars Program. It was meant to be given to students who are passionate, who are academically prepared, and who are ready to change the world. We are so grateful that we have a scholarship in order to help students to help the community.
These students who are receiving the Mission Award are grateful. Your contribution to the Mission Award enables our students to focus their attention on becoming compassionate and competent physicians. And when they have completed residency, they will happily return to the Inland Empire to serve in multiple areas where they're direly needed.
Knowing that there's people out there that may not even know you, but who are willing to give back and give towards your dreams and towards your education, that means a lot to a lot of us students.
I'm really thankful for the admissions panel, whoever they were way back when, who accepted me, and for whoever selected me to get the Mission Scholarship. They made such a tremendous impact on my life.
This scholarship told me I'm meant to be here, and it's continued to be this compassionate physician that genuinely wants to make a difference within my communities and within the Inland Empire.
We are grateful to each and every one of you for your contribution to the Mission Award.